Virtual dental exhibition of Whiteside. It's time for the next debate. Is it possible that a tooth decay could deprive an athlete of the Olympic championship? Let's listen to the experts of the debate, the impact of the oral health on the health of athletes. The organizers of the project are VDE, World Dental Federation, Virtual Dental Exhibition, and the Polish Dental Association. The debate will be moderated by Professor Ian Niedelman. Enjoy.
Lucas, thank you very much for the introduction and welcome to this webinar on oral health and performance in elite sport. So as Lucas just said, my name is Ian Niedelman and I'm moderating this session, and I lead the Centre for Oral Health and Performance at University College London, Eastman Dental Institute, where our team researches into the effects of oral health and performance in sport. I'm really thrilled this afternoon to welcome such a distinguished panel to this webinar. And as I mentioned, I wonder if you could just wave your hands. First of all, to introduce Tomasz Maciejewski. Thomas is, of course, needs very little introduction. A remarkable double Olympic shot put champion at Beijing, and very, very proud to say in London 2012 as well. And since then has moved on to become General Secretary of Polish Athletics. So a really important career. And Thomas, I also noticed that your nickname, I don't know if it still is the silent giant. Hope you're not going to be too quiet.
Something like that. I'm still big, maybe talk more, but a little bit more.
Excellent. I'd also like to welcome Professor Dr. Rainer Knoller. Rainer is a very distinguished sports scientist, and he's head of science at the German Athletics Association. Rainer, welcome this afternoon. And next I'd like to introduce Professor Mark Engels-Deutsch. Mark is Professor of Restorative Dentistry and Endodontics at the University of Lorraine in France. And he's Vice President of the European Association of Sports Dentistry. And he's also been consultant to FC Metz Football Club for 25 years. And last but very much not least, to welcome Dr. Zach Lee-Green. And Zach has been a member of Team GB Rowing for a decade, for 10 years since 2010, and recently has retired. But during that time, remarkably, still found time to qualify as a dentist. So a real polymath. And amongst his many palmares is a World Championship silver medal in 2017 in Sarasota in the lightweight men's quadruple scull. So welcome to you all, and thank you for joining us for this webinar. The webinar is part of the FDI Sport in Dentistry projects, and so I have the pleasure of working with the FDI in this. And I would also like to extend my thanks to the Sunstar organization for their sponsorship of this activity. And in the next 40 minutes or so, what we'd like to do is explore a number of themes with you, to have some debate and discussion, to look at the impact of oral health in elite sport, and the impact on athlete health and performance, to discuss the role of athletes, sport and exercise medicine, sport organizations in promoting oral health. What are their roles? What are our roles? And also to recommend key messages to improve oral health in elite and in recreational sport. And what we're planning is to allow about 15 minutes at the end for your questions and answer, and we'll try and answer as many as we can. So please submit these as early as you can to the platform. So after those introductions then, what I'd like to do is ask each of you in turn to this question: what is your experience of oral health in sport, and why do you think it's important? And I'm probably going to do this just in the order I can see you on my computer. And at the top I can see Rainer. So Rainer, would you like to start? Just tell us, what's your experience of oral health in sport? Why do you think it's important?
So speaking from the present, this is simple. I'm married to a dentist, and my wife, she runs a large clinic, and she used to be a national runner. So teeth and sports is a topic for me. I can't avoid it. It's a dinner topic at home and outwards, and this is fine. But more interesting is probably looking far back when I, as a sports scientist, as a physiologist, when I entered freshly this Olympic business we were gearing up for Sydney 2000, and I remember an astonishing case then when I was not in the teeth. We had a female hurdler, and she had lower back problems, and she developed really a lower back pain syndrome and the vertebra gliding in L6 and 7, and my colleagues in medicine, they did everything, you know, the whole spectrum, orthopedic stuff and x-rays and electric stimulation and so. Nothing helped, and in the very end, after weeks, she had pain, she reduced training, she had to stop training, and this is the worst you can imagine. If you are a high performance athlete, that's the worst you can have. He said, "Hey, what about your teeth?" And she said, "My teeth?" And he said, "Yes. You've been at the dentist?" And she said, "Not this year." And said, okay. Any problem? And she said, "Well, yes, my wisdom teeth here, this feels a bit uncomfortable, but I'm afraid to go to the dentist." And I said, "Okay, we stop right here. You go there, go for treatment, even let him pull it out, and then come back and we start again." And that's what she did. And she came back, they pulled the tooth out, it was slight inflammation there. And within a week, she could return to training, and the vertebra gliding disappeared from 100 to 0. I was so astonished. I can remember right now. So I got an idea that there must be sort of connection from teeth to spine to the rest of the body, so to speak. And well, now 20 years later, that's why we're here.
Sorry, classic mistake. I was going to say, Rainer, a very clear connection there. Thank you very much for that. Mark, can you tell us also
okay, thank you.
What's your experience?
So my experience, I want to tell you what I have do as my normal job and the feedback of the young player. So I am consultant for the Metz Football Club since 25 years, and I began to do conference and on oral hygiene for athletes and the medical staff. I've done regularly an oral examination of each young football player at the beginning of each school year and producing a formatted report. After, I do recommendation to see the dental practitioner, or if they don't have, to give them an appointment in my practice. The return and my feelings, I saw a difference for the beginning in oral health in the athletes coming from other parts of the world, especially from Africa, with more tooth loss, caries, periodontal disease, tartar and plaque. This was the first consultation. But the real fact was the difference in their oral health consideration from these young people.
Yeah.
Those who have been fully treated have become famous football players, playing in national team, for example, and I have never heard about the other. So I told them, you want not to ruin your career for a tooth.
Yes.
This was the message. And I remember this is an example of a young football player, 70 years old, center forward, injured 9 times during the first half of the season. I found him a big endodontic lesion on a lower molar. I treated it, and he had been injured only 1 time during the second half of the season, and it was a trauma and not a musculotendinous problem.
Right.
It was really the importance of the endodontic status of all the teeth of the player.
Okay.
This was my experience.
Well, thank you for that. Again, very, very clear experience over a number of years now. And Thomas, can I ask you the same thing? What's your experience of oral health in sport, and why do you think it's important?
Every part of your body need to be held. So So as a professional athlete, every 3 months I got like a healthy examination. I go to the sports clinic and see about 8 or 9 doctors. They check every part of my body. One of them was of course dentist. And if somebody was not okay, I don't have permission to train, because that is the main one of the main important things to oral health. So I need to fix it, and I got a permission to train. So that's the life for the professional athletes. Every part of the body need to be held too, because in the when you're training hard, you maximize your strength. Every part need to be ready. Every part need to be in 100% health, because if somebody will happen with the T, whole years of the training could be wasted. So take care about it. That's your responsibility.
Yeah. So Thomas, you're highlighting. It seems to me that you as an elite athlete, you're a very special person. You do extraordinary things. You take remarkable risks, so you may not see it that way. So you'd want to ensure that everything that can be in good condition is in good condition, and that
it's true. But because when you think about athletes, you think about the muscles, the bones. That's the mostly the reason of injuries. But sometimes it's like small things. Like teeth, eyes. Sometimes even smaller things, that everything can affect of your results. So
makes
if you're a professional sense. You want to be that your result will be maximized. So you need to take care about everything.
Yeah, great to hear that, Thomas. Thank you very much. Well, I'd like to come back to some of these issues in a moment. And Zach, same question to you. So your experience of oral health in sport, and why do you think it's important? I have to declare a small interest here in that Zach has very kindly supported a lot of the research that we've done with British Rowing. So a quick thanks to you for all your support and help, Zach.
That's not a problem. It's interesting because I think on the side of being an athlete, I've always had the experience of always trying to get those marginal gains. We're always trying to get that extra 1%. And I think more and more these days, we're always trying to get a little bit more out of our training. And I think oral health, in my experience, has been something that's actually been neglected, especially in maybe the British setup. Not many athletes have taken it particularly seriously. And if I'm honest, it's actually left to the athlete to sort out. Whereas, like we've just heard from Thomas, the musculoskeletal side is always being assessed. Psychology and everything like that is always kept on the forefront. And yet dental health is always kind of left to the athlete to sort out themselves. And only if there's a huge issue is it ever brought up. And so I feel like I've been very fortunate to have the knowledge, through my studies and being a dentist, that I've been able to actually help some of the athletes in the British rowing team. And I've spent probably the last 5 years or so helping the athletes to kind of learn more about their oral health and try and make sure that they are paying as much attention to their oral health as they do to their day-to-day training. They put everything into their training, day in, day out, as I have before my retirement. And I feel like it's a shame really to see performances be lost due to something that's essentially very easy to solve and look after.
That's really interesting, Zach. Why do you think it's important? I mean, that sounds like maybe a crazy question, but why is it important?
I guess it really comes down to the whole goal of being an elite athlete, isn't it? You're always out there to try and perform, and to perform at your best, and not only for yourself, for your team, for your country, whoever it is you're representing. And I think it can only be a benefit to have good oral health, and the importance of it is only shown through the examples of people who fail to take care of their oral health, and there's the huge consequences to their performance, and not just to the individuals. It's a bit different, I think, if you're performing as a single person, but in rowing it's majority a team sport, and so having an effect on your oral health as a part of a team it brings the whole team down. And I've got plenty of examples of that happening in the past.
Well, I can't resist asking you for. I was going to move on to asking you for some anecdotes then, and again, Zach and others. But Zach, as you were speaking, can you give us an example of when this has happened and what happened?
Absolutely, I think the most hard-hitting one for me was it was an under-23 World Championships, British squad attending with a full squad, and a very strong squad. And you're probably one of our best squads at that time. And one of the athletes developed an issue. At the time, it wasn't known. He hadn't seen a dentist for a number of years, and at an under-23 level, the engagement with the coaches, with the athletes, is usually based on kind of a summer program. So you're not really seen that much by the head coaches through the winter and the spring. And unfortunately, he developed an issue. It was dealt with at a very local level with the team doctor and a dentist over the phone. And unfortunately, there was no resolution that could be found. Unfortunately, the athlete was in too much pain, and not only was he in pain, but he was actually being kept awake at night, and he was feeling essentially really unwell, and that resulted in them having to withdraw from the event. And that was a World Championships. Now they had just qualified for the final at the World Under-23 Championships, and for them that would have been the highlight of their career. And unfortunately, that young athlete never performed at an elite level again. And not only did he not perform at that level again, but the three guys that he was in a boat with, unfortunately, also didn't perform at that level again. So their one chance, and to be honest, a chance at a good gold medal, because they were a very good crew, unfortunately didn't get to show how good they were. Yeah,
that's extraordinary, and I guess a story that would be helpful maybe to motivate others. And so what you've talked about is that they had a lot of pain. So if we're trying to think about why this might affect their performance, pain is an obvious one, and Thomas, you mentioned that as well. You've mentioned effect on sleep, and we know that sleep is just so important to the recovery process. And the fact that they were feeling unwell, presumably there was some kind of inflammation, systemic inflammation from the mouth as well. So quite powerful mechanisms of why their oral health might be affecting their performance. And anybody else? Does anyone else have a particular story about an athlete that they can remember where the oral health was affecting their training or their performance? Mark, I think you're going to mention one. Yeah.
I have another story to make another effect, and this example is not about pain, but related about an insidious disease. My topic, is endodontics. Yeah. And I had 4 years ago to treat a famous French tennis player. He had a very bad year in competition with a lot of injuries. And I have to retreat some maxillary molars and premolars with periapical endodontic lesions.
So you mean, so in other words, infections that were continuing to occur.
Yes. And after I have to collaborate with a stomatologist, and he had an aspergilloma in the sinus too. Right. So first we have to retreat the teeth, and after the surgery. 1 year later, he won 2 tournaments and reached a final in a major tournament. We were really happy for him. Here, this example is to say that the most important fact was, in this case, a misdetection of asymptomatic endodontic lesion.
Yeah, yeah.
It's important for us too, dentists, to check periapical status of apparently normal teeth or crowned teeth with a cone-beam conduit tomography for this accuracy.
Right.
So I want to go further and I want to tell to everybody the important fact is the microbiological status of a root canal in a pulpless teeth or treated teeth. This is very important to know that microorganisms can enter into a root canal before, during, or after a root canal treatment. And when you have microorganisms in a root canal of a pulpless teeth, the immune system cannot reach this field. So the microorganisms can spread from the tooth and reach every organ in the body. And in particularly, organs which are very used by the athletes, muscles and tendons.
Yeah.
And this is really important to make a thorough exam for this.
So you're emphasizing the importance of that detailed, thorough examination. Somebody like yourself that is asking questions, why is this? And looking further and further to try and find that cause. And I think both you and Zach have also highlighted that what goes on in the mouth, not surprisingly, can affect the rest of the body. And your expertise is in root canals. My particular specialty is gum health. And we know, for instance, that gum health can affect diabetes. We've got some really good randomized controlled trials that if you have inflammation in the mouth, it makes it harder to control diabetes. And when we know that there are these links, perhaps it's less surprising that that it has an effect on elite sport performance. And again, it echoes what Thomas is saying there. You want to be in tip-top condition. Does anybody else have any particular anecdotes about an athlete or a team that where they were aware that their oral health affected the performance? So what we might do then is perhaps then ask this question then, and it's already come up to some extent. I think Zach was mentioning it. What do you think athletes should know about their oral health? So we're thinking about the elite athlete. What should they know? Would anybody like to make some comments on that? Yeah, Zach.
I always find it quite interesting when we look at what athletes should know, because I think when it comes to things like physiotherapy, musculoskeletal problems, a lot of athletes almost leave this to the physiotherapy team or the coaches, or depending on what the setup is. And I feel like dentistry, like I said before, is very much left to the athletes. And so the information, the knowledge that they're given is often that they've learned at school, or they've gained from their usual dental checkups. And I remember whilst I was in my first year at university, finally learning more about oral health. And I went to my local dentist for a checkup. And I said, look, I'm an elite athlete. I train every day. I eat a lot more food than the normal person would. I train all day. And is there anything that you can suggest that might be beneficial to me as someone who's probably more at risk of gum disease, of caries, etc.? And unfortunately, the only thing they turned around to me and said was, don't eat sugar. And I thought, well, that's a real shame that there was an opportunity missed. Now, I was really asking out of my own curiosity to see if they really knew any, if there was something that I didn't know that they knew, and I wanted to be able to kind of learn more. And so I kind of feel like it maybe it's our job as dental professionals, as coaches, to educate the athletes, to give them the information, the knowledge, to say, look, you are special in the fact that you are athletes, but you're also special that you are a much higher risk of these problems.
Right.
And also that we probably need to give you some more information to make sure that you're performing at the very highest level. Think of all the time and money and effort that goes into getting these gold medals at the Olympics, and what a waste it would be to see that thrown away because they haven't looked after their teeth. And it's such an easy thing to do.
So Zach, if I've understood you right, you're emphasising is athletes need to know that compared to the general population, they're at greater risk of oral problems. I think that's really pretty fundamental, the point you're making. And secondly, athletes need to know that it can affect their performance. And do you think athletes know this?
I have to say, I'd be surprised if anyone knew that it affected their performance, but most athletes that I've spoken to, and I can only speak mostly for athletes in the British rowing team that I've seen myself, in a professional way, but if you tell them there is potential for performance gain, or at least less performance loss, I would say that 99% of them take that information and they improve their oral health immediately. They're actually significantly better, their response to instruction, than the general population. You can tell, you can tell Joe Bloggs on the street, you much brush better, and you show them how, and you may get 1 in 2 come back and do a better job. But athletes are fantastic at absorbing information, and that's usually how they've got to that elite level, because they've taken information from the coaches, from the people they work with, to reach that really high level. And they always absorb this information and quite often come back and surprise me with how amazingly they can improve their oral health. So it's clearly they have the ability. It's just, again, getting that knowledge across to them to make sure that they can do the best job.
So you're suggesting, if I understand rightly, that the information is there, but what you're also very smart there is you're identifying what might be the motivators. So just talking about oral health may not be particularly interesting to an elite athlete, but you've identified that talking to them about performance is really important. And Thomas, you were also mentioning the appearance, which is also maybe another way of finding a way in to talk about oral health, and without necessarily just talking about tooth decay and gum health. Is that something that you've found helpful when talking to athletes, Thomas?
If you're like a top athlete, elite athlete, you always think about what more I can do to be better. Yeah.
Yes.
I doing on my training is on the maximal level. So you ask yourself, what can I do in my normal life to do it better? And one of them is take care about my oral health. Yeah.
Yes.
The better smile is always something you need. Yeah. Now the top athletes are the product. Yeah. Yes. Everything that that you have after the years, that's the pictures. Yeah. And your face, your smiling face on the podium. So you need to take care about that, and that will be something you can with something you can be better with that. Yeah.
Absolutely. We've just published a study looking at behavior change in elite sports, and the top motivator. We also looked at after the event, what was the top motivator, and the athletes, 94% of them, which is really high, they reported that it was their wish to avoid inflammation in the rest of their body that was the biggest motivator to do something about their oral health. So it wasn't about less tooth decay or less gum disease, it was about this link with performance, which is, I guess, what you're saying. And perhaps we'll come back to this a little bit later when we talk about the role of the dental professionals. But I guess as a dentist, we also need to understand the athletes well so that we can position the messages and the information that you've just been talking about. So just moving on a little bit to ask the question at the moment, and I think I've got the sense of what the answer is from several of you already, is oral health a routine part of athlete medical care at the moment, do you think? So, I mean, Rainer, perhaps in terms of the German Athletic Association, how is that plan? How is that moving in terms of oral health within sports science and athlete care?
I think it is part of their routine, but I have to mention it is not a part that is covered by central institutions like the federation. So in this case, the individual interest and the coverage by the federation, this collide a bit. So it goes together. If you offer something for an athlete that is obvious, to say, okay, if you go to a training camp, there's a certain risk that you get injured. We will bring a doc. This is obvious. So, okay, fine, better for them, or a physio. But if you say, well, we got a dentist, if you go there, this might be good for you. This is more or less theoretical. We made this experience. We established a national monitoring system to check the recovery and to bring training load and recovery together to make a better individual training. And part of it was also the medical stuff to tell if you're injured or not. And the athletes said, well, I don't need that. I said, why? Well, I've never been injured. It's that simple. So if they were perfect and they performed excellent, they said, I don't need that because it's fine. But every high performance athlete who had a severe problem said, whoa, that's cool. I would have wished we had this years before. So this is the problem. So if you offer something that is surplus, they say, we will see. But if they realize that it might help them as is essential, they will do. And in the oral case, I think the interesting thing is if you make them clear that if they have undetected problems, this will have a big influence on training and performance. So you might not see it, you might even not feel it, but there might be a problem which is the cause for bad training or maybe not perfect performance. Then you get it. This is the entrance, in my opinion. And we are not there to answer the question because this is so delicate, one after another. Oral healthcare is the second step after the medical part in the monitoring system. Yes.
Yes. And Thomas, I think you were suggesting that I didn't quite understand whether it's the Polish Athletic Association has already adopted this, or were you suggesting that this is generally very important?
Like I said, we got like a monitoring system or a sport clinic, like a central sport clinic in Poland. If you are in elite, you need to go there and check everything. Dentist too. So that's one of the parts that you are responsible to. Your blood, your body, everything. Teach too. About monitoring system, we got something similar like a German, but we don't ask athlete. We ask physio. They said true. Okay, these guys get the trouble with that. That's probably the better information, more true we get from the physio. So about every part of their body. So that's the difference. Yeah. So if you are in the great shape, if you are young, you don't need much. Yeah. You are healthy. You feel unbreakable. If you are more experienced athlete, you take care about more things because you know that everything can break it and everything and you know that you can get injury in 1 moment like that, even in the smallest things. So the knowledge is the main thing. I know. If you say somebody that part of your problem can take from the things you never suspect, like teeth or from your eyes or stuff like that, people can think about it and take some answers.
That's Thomas. That's really helpful because you're echoing what several other people have said, in that the knowledge needs to be there, but even if you tell athletes, they may not act upon it. What do you think? How can you convince them? How can you motivate them to take this action, and preferably at a much earlier stage, maybe even as youth athletes? What do you think would make a difference?
I think that the talks with the top athletes, like experienced people who go to the young kids who just start their career and say like it's normal you do it.
Yeah.
If you want to go there where I was, take care about that. Take care about that. Think about that. And one of them is of course your tea. Because one of the main thing can hurt you.
Yeah, so that's great. Sounds like you're volunteering for a role here, which is great to hear.
Maybe not volunteering.
Okay, thank you for correcting that very carefully. And Zach, I saw you had your hand up, and also Rainer afterwards.
Yeah, I think it's really interesting. If I think about the athletes that I've worked with, I think to get them to buy into it, I think it's increasing the access to it, making it really easy for them to get to it, because athletes are notoriously great at turning up to training if you tell them what time training is. But the moment they finish training, that's it, they're done. But if you have the physio session, they'll be there. If you make that accessible, really accessible, say you have free access to dentistry, or the dentist will be here to complete all of your checkups on this day. We used to often, we used to have vitamin D tests, for example. Everyone would get it done. And I'm sure, Ian, I mean, we were part of the study that was taking place in the British rowing team headquarters, and every single athlete was if it was there in the building, they would happily take it.
Yeah, I'd echo that. Sorry, Zach, you've just frozen for a moment.
But that was it.
Yeah, so Zach, again echoing that. So we've now got data on well over 800 elite athletes, and we've never had a problem with access to athletes as long as we go to you. We always go to your training centres.
Absolutely.
Rowing, or we never ask you to come to us. And Rainer, what about you? You also were going to make a comment on this.
Yes, to complement what I said before, we ask the athletes, Thomas, but we also ask the staff, we ask the docs and the physio, we ask both.
Yeah.
So what you can't know is how tired someone is. Just himself knows. So this is a normal training, and he may be exhausted despite it's just normal, or he may be fresh despite it's hard. So we need this for individual training optimization. But despite that, we need information. And I think it's pretty simple. If you have kids, you have to show them to brush the teeth. You have to take this thing and left and right, and you have to form a certain habituation, and they know this. I think athletes brush teeth, right? And if you enlarge this small procedure in the morning and in the evening for what is necessary, that you clean your interdental space and that you go there twice a year, maybe make it a part of the medical check, then you're the winner. This sounds so easy, but it's so complicated. Otherwise, we wouldn't sit here, right? And we're not there, but the ideas are here. And Ian, thank you for calling back in those topics. I think it's information and then habituation. Especially for Germany, to give you an idea, maybe Thomas, it's easier for you. I don't know. In Poland, Germany, it's a mess because we're a federal state. We got 13 Olympic centers. We got a national training center, which is excellent, near Berlin, but they just go there for training camps. To get you an idea, they train where they are in their clubs. So we got, only in athletics, we got 350 athletes, 60 full employed coaches, and another 30 via constructions in clubs and so. And if you combine them, this is a big issue. And so obviously oral health seems to be a very, very minor one. Yeah.
But what you're saying, Rainer, is there's a fantastic opportunity here, because although it might seem having all of these different federations and different parts of the organization is a challenge, if, as well as the athletes, we can harness the activity of all of these different people in the federations, and the nutritionists, the physiotherapists, if they also have an understanding and perhaps a belief that oral health is important, then we may have different opportunities at different times to keep these messages coming in. And you've also said, and I think Zach was also highlighting this, it's got to be convenient to meet the dentist, actually to have a checkup, but it's also what we're asking them to do also has to fit in with quite a detailed, regimented training day. So it's no good asking people to do things when they may be going to a training session. So it's making sure that we understand the mindset, perhaps of the athletes, which is the most important thing, but also we need to understand what are the coaches, what are they demanding of the athletes, so that again we can fit these things in. And what we've also tried to do is to provide all of the bits of kit that athletes need for their oral health to them, so they don't have to go and shop for this, because if somebody's got to go and buy it, it will not happen. So again, it's the convenience and understanding that. So let's perhaps now look at the, Mark, sorry, you were going to enlarge on this. Tell us.
I want just to return of what Raina said just at the beginning of the answers, is the medical examination first and after the dental examination. I want to tell you a story which happened in a sailing club in France. You have the medical staff made the examination of the athletes, and after they told to the dentist, do that in 5 minutes, and after fill the bar. That was the job of the dentist. And I want to say that this is changing today, and I don't know if you have read the publication in Dental Traumatology this month of a consensus statement on sport dentistry integration in sport medicine. We must say now, not one medical, second dental. We are both, we are really a part of the medical examination.
Yes.
We must be connected to contribute to the prevention, screening, treatment of the dental caries, dental erosion, periodontal disease, malocclusion, temporomandibular disorders, or other injuries. And this is the first step. It was this consensus statement from, it was in Paris in November last year. And I think it's a beginning of a new project with researchers and publication and implication of the athletes in this topic. Yeah. To be only one topic and not one and another one, and generally a little one. No, this is changing and changing, and it's a very, very important and a good thing.
Yeah, Mark, absolutely crucial to have integration. And Ronnie, you're going to comment on that?
I just wanted to mention that I totally agree. And what I meant is that we didn't implement it yet in the structure so far as Olympics is concerned. You know, medical routine examinations are yearly since I don't know when, since I had diapers on, but dentist stuff is not implemented there, but we have to. We know about it, and the next step is we look for structures to implement it. I totally agree.
Yeah. And you're right, this is a great opportunity. Certainly the International Olympic Committee, the IOC, have moved a long way. We've worked a lot with them, and they're very interested and understand just how important these things are. So I think there's a great opportunity now that we perhaps didn't have even 5 years ago. So just before we move to the questions then, there may well be a number of keen athletes, recreational athletes listening in. Do you have any key messages for them in terms of their oral health, and perhaps if they are dentists, also what they can do to support the oral health of athletes they may be working with? Does anybody have any comments there? Yes, Zach, thank you.
I think it's important to, I think as both Mark and Rainer have said, and Thomas, I think everyone's almost on the same page. You have to take dental health in line with with medical health. It's not a different thing. Your teeth are within your body, and it is important that we put it all in the same package. And for those people, especially in recreational sports, who, you know, probably it's more prevalent, maybe picking up injuries. I mean, I'm just guessing that, so I have no evidence to back it up. But you know, it's quite easy, I think, to overlook something ever so simple. And as if you're a dentist as well, what a perfect opportunity to impart that knowledge you have as a dentist onto those taking part in recreational sport, and share that knowledge with them and help them to maintain their oral health, even if it isn't for their just for their performance, their, how they get on in recreational sport, but just for their general health, because now we've seen so many studies linking general health and oral health.
Absolutely. Yeah, thank you for that, Zach. Any other key tips that or key messages would you have for recreational athletes, or for dentists that are managing the health of athletes? Certainly, from our experience, I think some of the key messages for recreational athletes as well, that there is the increased risk of oral health problems. We mustn't be misunderstood though. Physical activity is a very good thing. So we wouldn't want to wish people to start reducing their exercise and activity, but just to recognize that there are things that they can do to support their oral health. One of the things is, of course, is to have regular checkups, and we perhaps suggest at least twice a year, and just to treat your dentist as your coach. It's becoming very common for recreational athletes to have coaches, but maybe we don't think about our dentist as a coach, as opposed to somebody that fixes a problem. Just use your coach, ask them for advice, ask them for an assessment of how you are, and then work out a program of what you might do. So again, a kind of strength and conditioning for the mouth. I don't know if anybody else had any additional comments on that. If not, then let me just take a look. Excuse me a second while I just look at the questions. Then we've had a few questions come in, and the first question is this. It seems that dental problems that affect athletes fall into acute pain issues or chronic inflammatory issues. Obviously, chronic inflammatory issues are really interesting. How much do we understand about the impact of low-grade gum inflammation on performance, and can we change performance by treating and correcting these? Is our understanding limited or improving in this aspect? And that's from a periodontist in Ireland. Has anybody got any? That's quite a detailed question about inflammation and performance. If it's not about gum inflammation, perhaps from the medical science, is there any evidence that inflammation has an effect on sport performance or recovery? Rhino, are you aware of, not so much necessarily from the mouth, but elsewhere? Is inflammation something you're concerned about?
Can you repeat the last sentence? Because
yes. So in your German Athletics Association, when you're looking at athletes, is inflammation something you're concerned about? And if they have inflammation, could it affect their performance, their recovery, their risk of injury?
Inflammation in the body, definitely, but inflammation in the mouth, therefore you have to have a dentist there, and we don't have a dentist in our association, so
yes,
so it has to go together with their visit at their dentist.
Right.
So yeah.
So you're saying that you are concerned about inflammation in any case, and at the moment you're not assessing whether it's coming from the mouth, but if it was, that's something that would be of concern to you, maybe. Have I understood correctly?
Yes.
Yeah, and I think Mark has already highlighted microbial effects from root canals, which to a great extent will also, the mechanism there will be inflammatory. So that's, we can think about gum health, we can also think about infection and inflammation within the root canals. So the answer to the question, do we have lots of information about it at the moment, lots of data? The answer is no. We have lots of evidence that oral inflammation affects general health, risk of cardiovascular disease, effects on diabetes, very clear and potentially life-changing effects. So for instance, inflammation from the mouth can, if you treat that, can improve diabetes to the same level as taking a drug, a diabetes drug. That's a really big effect, and it just shows that there is this relationship. We've got quite a lot of self-reported data, and we find that in our self-reported data, again on sort of several hundred athletes, that about 20 to 30% of athletes report an effect from their oral health, a negative effect from their oral health on their training or performance. That's a large percentage, 20 to 30%, depending on the studies that we've done, and much greater than, for instance, an individual with pain. So it would seem that the likely cause for that, as well as things like pain, would be inflammation. Yes, and Mark, please, have you got something to add to that?
I want just to add the crucial role of dentists in the detection of the infectious dental disease. When you have a periodontal cause, it's normally easier because you have a accessibility, you can do a probing, and you have a radiological reliability.
Yes.
When you have an endodontic cause, you never know really the pulpal status of a molar. For example, you have a branch vital, you have a branch necrotic, you have a branch inflamed.
Yeah.
The radiological investigation is more difficult too. So
Yes.
it's sometimes really difficult for the dentist to screen to focus to the problem, and in particularly when it's apparently invisible.
So you're suggesting, I guess, that there is a role not only for general dentists here, but for specialists where these problems can't be identified. Mm-hmm. Is that correct? Is that, I've understood that? Yes,
but that must be in the reach for every dentist.
Yeah, yeah, okay. So the next question we have, thank you all very much for that. So the next question is, when I'm suggesting an annual checkup by X-ray, there's resistance from authorities because of radiation protection. Knowing is the only way to detect problems. How can we convince the authorities about the importance of X-rays, particularly maybe more specialized X-rays like these 3D cone beam CT, which is a 3D X-ray? How can we convince people that that may be needed at times for a diagnosis, and the reason for the uncertainty is because of the radiation? Mark, but Zach and Mark, I'd throw both of you. So Zach, first of all, you had your hand up.
I think it all comes down to justification. You need to be able to justify any sort of radiological exposure to an athlete, to a patient. And I don't think athletes should necessarily be exposed to this extra radiation if it isn't required. However, in instances where it is justified, we shouldn't be holding back. And I think, whether it's from an athletic side or whether it's in the general public, I don't think you'll find the authorities refusing or resisting radiological examination if it is justified. And that's the key thing for me, is the justification.
Yeah, yeah, that's a great answer. Thank you for that. Yeah, Mark, please.
I wanted to the question about the diagnostic accuracy of radiographic methods in the apical periodontist detection. We have to know that the orthopontomograph detect only 17 to 21% of the endodontic lesion. The periapical radiographs only 35 to 36% of the periapical lesion, and they need to see them 30 to 50% of a mineral bone loss. Yes. So we have to shift to the CBCT, and this performed, you can detect 63 to 74% of the lesion.
Sure. So it's, again, I think you're both saying similar things. It's important to carry out a careful clinical examination in the mouth, and obviously a very careful history, and to choose the type of X-ray that's most appropriate. Thomas, I think you were going to also.
Sorry guys, I need to leave because my sons wanna go outside to play. So sorry. It was fun with you.
Thomas, thank you very much for your participation today.
Bye,
That was
Thomas.
fun.
Great pleasure
See
to
you
have
guys.
you. Bye-bye
Bye.
now. So the next question is really a very apparently straightforward one. Can anyone simply explain why athletes have more problems with their oral health than other people? Would anybody like to have a go at answering that question? Yes, Rainer, please.
It's not that complicated because athletes, they ride on a sharp knife, as one of the coaches said in the athletic federation. You go all in and you give everything, and you train so hard, and you have to regenerate every night. So there's a lot of pressure, and you never know. Everything could be not worth it. Maybe you give all and you lose all. So there's a lot of stress. And so if you stress, you grind your teeth at night and you press them. Everyone knows this before any examination or so. And you drink all those sour stuff the whole day, which ruins your teeth. You don't drink those, these energy drinks as a normal person, but especially if you're an endurance athlete. I was triathlete in my young years. You drink this whole day. If you cycle 150 kilometers, you drink bottles of them. So I didn't have a clue about that. This ruins your teeth. So sports is healthy, but high performance sports is not about health. It's about performance, and it's about winning. So you take into account that it's a tough thing. And well, I think most people still don't know this. That's the reason, my opinion. Zach, maybe you will agree as an athlete,
So Zach, you appear still to have some teeth there, despite being a high-performance athlete. So what did you do to protect your oral health?
I think I've been very lucky. I was brought up with quite strict rules on my oral health by my parents, who aren't particularly sporty in any way. But I think it's the commitment to it. It's the knowing that you have to take care of it, and it's taking extra measures to try and make sure that you do more. In the same way that we might recommend extra measures for people who are suffering with more dental problems in the the normal community, in the general population, using extra fluoride, making sure that the toothbrushing is absolutely high quality. It's not just throwing a brush around. It's making sure that you're getting everywhere. It's using interdental brushes, and I think it's just having awareness. Awareness somehow seems to help quite a lot, and I seem to generate a lot of saliva as well, so I think that helped me.
Okay, so that's very handy. And I'm also just looking at the chat here. There's a few questions again, and one from an oral hygienist wants to know, and it's again, I'm afraid, Zach, it's pointing to you. It's asking you specifically, what can you do if the advice on food is not in line with the education about food and oral health?
Yeah, I think this is from Jolanda, isn't it? Thanks very much. That's a very good question. Yeah. And that is one that I find myself conflicting, actually, because obviously when I'm helping out the athletes in the British rowing team, I'm often recommending avoiding these sugary drinks, as Ryan has just said about. And it is very, very difficult. It is, like we've said already as well, they are balancing on the knife edge. And I think what's important is that when we're trying to get performance, then we use every method possible to get performance. And when we're trying to maintain health, then we maintain health. And I think when an athlete isn't performing, when they're not doing their training, they don't need to be drinking a sugary supplement drink or anything like that. That's the time to be consuming high quality nutrition. And that's kind of what I've managed to get from our own nutritionists in the British rowing team. But however, I do feel that in some situations, in some sports, and cycling is a great example where they are cycling for 4, 5, 6 hours a day. They need to be absorbing those calories, and at the same time, they're likely to have slightly less saliva, just because of all the cycling and obviously all the effort. So I do think that there is space there, and it should be that dental professionals and the coaches and the medical teams are speaking together and trying to find ways to mitigate that, whether that's using mouthwashes, whether that's accepting that there will be a mineral loss, but we try to make up for that as best we can afterwards. But it is very, very difficult. And I think that communication, having that conversation is the first part of that.
So what you're saying there you're really accepting from Yolanda that athletes may need to use drinks, foods that are challenging to oral health, but you've introduced a really important concept, which is mitigating the risk, which may be a little bit different from prevention. So instead of don't use these performance enhancing supplements, use them when absolutely necessary, but mitigate the risk by these additional steps that you've talked about, the regular checkups, you've talked about moving up to high fluoride, you've talked about coaching in the right techniques for toothbrushing and cleaning between your teeth, not just throwing a toothbrush around. So I think, Yolanda, that's really helpful advice. I'm very mindful the clock has tripped round to the hour now. So we were scheduled to stop at this point in time. There are still some questions, and I'm really sorry that we don't have time to answer more, but I think we've answered a good representation of them. So again, I'd just like to thank our panelists, particularly Rainer, Mark, Zach, and Thomas. Thank you all very much for giving your expertise today and giving up your time this afternoon. And great thanks to the VDE and to the FDI and Sunstar. And we look forward to seeing you again, hopefully not too long. Thank you very much. Goodbye now.
Thank you, Yang. Thank everybody. Say hi to everybody.
Bye-bye.
Bye-bye.
Bye-bye now.